1 in 6 of us will suffer a stroke in our lifetime. It's the leading cause of long-term disability. The good news is that effective treatments exist and can reverse the impact. However, this treatment has a time window and can only be administered in a hospital. Unfortunately, the vast majority of people don't get to the hospital to receive the treatment in time. When a stroke presents, people realize they're having a health problem, but they often don't recognize the signs as a time-sensitive medical emergency and immediately call 911. In fact, about a third of all strokes, people seek out non-emergency medical care by calling their physician or by driving to urgent care. A typical scenario: my husband's not feeling well. He's having trouble with his arms, feeling weak, and not speaking properly. Can I get an appointment right away? Medical office staff answering the phone or checking in a patient aren't routinely looking or listening for stroke signs as part of their jobs. Consequently, an appointment is given for later that day or the next. In the meantime, the stroke is progressing, killing 2 million cells a minute, and the treatment window for most strokes, which is 4.5 hours, is slipping away. The result is somebody that might have benefited from the treatment may be permanently disabled or die. To reduce pre-hospital delay in stroke treatment, the Virginia Stroke System Task Force, in conjunction with the Medical Society of Virginia, the Virginia Department of Health, and the Virginia Hospital and Healthcare Association, approved a Stroke Smart medical practice standard of care, which consists of 5 easy actions. Number 1, staff training, educating all staff, particularly call takers and check-in personnel, to listen or look for the signs of a stroke. If the patient describes any sign, a Stroke Smart medical practice would follow the practice protocol to call 911. Number 2, phone system, modifying the voicemail or on-hold message recording to describe stroke signs and advising callers to call 911 if they suspect an emergency. Here's an example. If you're experiencing any of the following signs: arm weakness, a droopy face, or trouble speaking this is a medical emergency, call 911 now. Number 3, patient education. Provide Stroke Smart materials to your patients. You can place the materials in the waiting room and or hand the materials to your patients. Since the CDC reports that 80% of Americans visit their medical provider every year, it's an excellent place to educate patients to be stroke smart. Medical materials can be ordered at no cost on the VDH website. Number 4, flag high-risk patients during intake. The electronic medical record can flag high stroke risk patients. The nurse can specifically educate them on stroke awareness, provide them with a stroke magnet or wallet card for reinforcement. Number 5, measurement. Tracking progress at the practice level. This may be the number of magnets or wallet cards distributed to patients, number of appointment call-ins that were suspected strokes, percentage of personnel trained in stroke signs.
I am Joe Wilkins, president of St. Francis Medical Center, and I am proud to announce that Bon Secours Richmond Health System is the first Stroke Smart health system in our country.
You know, stroke is the #1 cause of permanent disability, and it's the leading cause of death. VCU Health is proud to join our Richmond community to spot a stroke, to stop a stroke, and to save.
As part of Stroke Smart Virginia, the Medical Society of Virginia, the Virginia Department of Health, and the Virginia Hospital and Healthcare Association are all encouraging all health systems and physicians' practices to consider this best practice. We are available to help you get started. It requires no provider time and easily fits into your workflow. As of this filming, the following health systems are becoming Stroke Smart medical practices: Inova, Mary Washington Health Center, VCU Health, Bon Secours, and Augusta Health. If you can spot a stroke, you can stop a stroke and save a life.